Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan, Salam Pancasila. Good morning and warm welcome from Indonesia, Honorable Dean of Fakulty of Farmasi Universitas of Pancasila, and Vice, the Honorable Speakers and Moderator of International Guest Lecture today, the Honorable or participants joining us online in this guest lecture today. Before we begin this lecture, allow me to introduce myself. My name is Amalia Zahra Apriliana as the Master of Ceremony of this lecture today. This is a grateful opportunity for all of us. In the middle of the weekend, the speakers are willing to take the time to share their knowledge with us about pharmacology and clinical pharmacy. Ladies and gentlemen, before we continue to the next agenda, we would like to invite you to sing the national anthem of Indonesia, Indonesia Raya, followed by hymn of Universitas Pancasila. For all participants, please be seated properly.
Universitas Pancasila, tetapkan hati masa depanmu secemerlang mentari. Tetapkan hati para dosenmu berjuang untuk kebenaran.
All right, thank you. International guest lecture today, gonna talk about pharmacology and clinical pharmacy with our amazing speakers. And before we continue to the next agenda, up next we would like to invite, okay. Up next, we would like to invite the Dean of Faculty of Pharmacy of Universitas Pancasila to give a welcoming speech and opening remarks to Professor Dr. Apoteker Syamsuddin Magister Biomedik. The time is yours.
Thank you, Amalia Zahra. Assalamualaikum warahmatullahi wabarakatuh. First of all, let us thank God, the Almighty, who has given His grace and guidance so that it could be held. Beforehand, as the Dean of Faculty of Farmasi Universitas Pancasila, I would like to express my high appreciation for the presence of Professor Dr. Erwin Peller from Director International and Linkage San Pedro College, Davao City, Philippines, and Assistant Professor Dr. Muhammad Junaid Farooq from Department of Clinical Pharmacy, UCSI Malaysia, as guest speaker in International Guest Lecture. International Guest Lecture involve foreign guests at the invitation of the Faculty of Pharmacy intended for students. This kind of activity is important in providing greater insight and knowledge for Faculty of Pharmacy Universitas Pancasila students, especially in the field of pharmacology and clinical pharmacy. Students can take advantage of this moment to continue to explore knowledge and get to know the ins and out of pharmacy. Finally, I hope this guest lecture can provide new insight, inspiration, and deep understanding to advance pharmaceutical science, especially pharmacology and clinical pharmacy. I invite participants to actively participate as question and discuss during the event. I would like to thank to the committee for organizing this event well, Budiah Ika and a team. Let us welcome the guest lecture with great enthusiasm. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Before we continue to the next agenda, it's a photo session. So for all participants, please turn on the camera. All right. I'm gonna lead this photo session. For slide 1, there's so many participants we have here. There is 10 slides in me. So for the first slide, 1, 2, 3. Next slide. 1, 2, 3. The third slide. 1, 2, 3. All right. That's all. I think I already screenshot this photo session truly. And once again, thank you so much to Professor Dr. Apoteker Syamsuddin Magister Biomedik to open this guest lecture today. No? Okay, all right. Now we move on to the main event of our meeting today. Pharmacology and clinical pharmacy is a big part of being a pharmacist. So there are still many new things that we need to dip in this field. Therefore, our topic today will increase our knowledge because our wonderful speakers are come directly from Malaysia and Philippines. But before we begin our lecture, I would like to introduce our moderator for today, Apoteker Hesti Utami, PhD. Apoteker Hesti Utami PhD as lecturer in Fakulty of Farmasi Universitas Pancasila for undergraduate pharmacist internship, master program, and doctoral program. She graduated from Gajah Mada University for bachelor and pharmacist, University of Queensland, Australia for master program, and Curtin University, Australia for doctoral program. She has so many lists of publication through oral or poster presentation, more than 15, and research more than 50 publication. She also active as national and international journals reviewers. So without any further ado, now already joining with us. Good morning, Miss Hasti.
Good morning, Amalia. How are you today?
I'm good. What about you, Miss Hasti?
I'm good. Thanks.
I see all the participants here are so excited to hear about our lecture today. So by that, all the participants is yours.
Okay, thank you so much for the nice introduction. I would like to welcome Assistant Professor Dr. Junaidi Farooq to join us this morning. Good morning, Dr. Junaidi Farooq.
Thank you. Good morning, Prof.
Aha, how are you today? I'm not prof already.
I'm fine, thank you. Nice to see you.
Yeah, how's the weather like in Malaysia now?
Now it's early in the morning, cloudy weather, but Malaysia is unpredictable. We don't know how it will go after a few hours.
Okay. What we have here in Indonesia, we have a raining almost every day. So thank you for coming to our international guest lectures, the first series on pharmacology and clinical pharmacy. So basically, the guest lecture series is conducted as the part of the event to celebrate the anniversary of our faculty, I think the 60 at the moment, right? And we will have the big day on the 13th of July this year. So for the guest lecture series for today, we will have two speakers. The first one, Assistant Professor Dr. Junaidi Farooq is already with us. And after that, we will have Professor Erwin Martinez of Feller. Okay, before Dr. Junaidi Farooq give his lecture, allow me to briefly read through his bio. So Dr. Junaidi Farooq is a pharmacist, clinical pharmacist, the same as me. And he has a long-standing experience working in hospital and also as academia at national and international institution. And he did his Doctor of Pharmacy at RIPA International University, and then he pursued his education, taking Master in Clinical Pharmacy at University of Sabah Jaya, Malaysia. And then he did his PhD in Clinical Pharmacy at University Kebangsaan Malaysia. At the moment, he's the assistant professor at UCSI University Malaysia, and and he's also the head of the practice, industry, and community engagement. So handling the MOU arrangements, student exchange, student mobility, and community engagement. He also participated in teaching and research supervision, and also taking a role in problem-based learning and clinical clerkship. And he has published numerous publications. Well done, doctor. And also a reviewer, the reviewer in some journals and prestigious publication. Okay, without further ado, doctor, you have about 30 minutes presentation. And after that, we will have about 15 minutes for discussion. So, ladies and gentlemen, Dr. Muhammad Junaidi Farooq will present his lecture on breaking the pill barrier, navigating the complexity of medication adherence. The time is yours.
Okay, thank you. Thank you, Dr. Hesti, for a nice and very detailed introduction. And good morning, all dear students. So you already have my introduction. So basically, I am from Pakistan, and then I moved to Malaysia, to advance my career in clinical pharmacy. So today I will be talking about some areas of medication adherence, that what are different kinds of barriers and how those components can affect patient medication taking behavior. Let me just share my screen. Okay, so breaking the pill barrier, navigating the complexities of medication adherence. So when we talk about medication adherence, so several terminologies, it comes in our mind because that is what we come across in literature, different guidelines, different textbooks. They may use different kinds of terminologies for that, like compliance, persistence, concordance, adherence. So the question which comes in our mind is, are these synonyms or is it some difference between these terminologies? And which is the internationally recognized term when we talk about medication taking behavior of the patient? So among all these terminologies, basically it is different levels, whereas compliance is the first or basic level of patient medication taking, in which they are just following the instructions of the prescriber or healthcare professional. Then after some time, because adherence is a continuous process, we cannot medication adherence like for short duration or acute treatments. It takes at least 6 months time for a person to develop their habits. So that's why we call adherence as a long-term process. So after patient, start taking the medication regularly and they start to change their habit, they achieve the persistence level because now they are following a continuous regimen on daily basis. Then when they keep on practicing that, they reach the concordance level. Now they are, in their mutual what do you say, collaboration with the healthcare professional, but still it is not a shared decision making process. Then finally adherence level is achieved, in which now both healthcare provider and the patient themselves come at the same page, and patient at this point, they are in charge of that process. It's a shared mutual decision making process, and it is not only related to medication taking, it's also related to their lifestyle, their dietary patterns, and it's all the items which are affecting patients quality of life. Okay, so that's why worldwide we use the word adherence, which is recognized and accepted globally by World Health Organization, your American Pharmacist Association, even NIH. So in Malaysia also, to standardize it, we use the term medication adherence. So as per the definition, we can see it is the extent to which a person's behavior in taking medication, following a diet, lifestyles correspond with the agreed recommendations from healthcare provider. So here we can see the complete concept of medication adherence, that it is not only focusing how the patient is taking the medication, rather we also see other components which includes their diet and other lifestyle parameters. Okay, so moving on. So in general, how we say or how we determine that, oh, what is medication adherence? So it simply starts with the right drug, which is taken in right amount, which is, correct dosing at the right time. Right time means OD dosing, BD dosing, TID dosing. When it comes to antibiotics, you have to take it at the same time. Same goes for antipsychotics and also your neurotherapeutic index, TDM drugs, warfarin. So you have to even, follow the timings. And also, when we talk about parenteral drugs, so parenteral drugs, which means the injectables, we don't really write it once a day dosing or twice a day dosing. For injectables one, we go with the hourly basis, like Q8 hourly, Q12 hourly. So we really have to adhere to the exact timings. So that is the right time. Then in the right way, so like it can be, with food, without food, to avoid any interactions, and for the right duration of time. So specifically with antibiotics, so we know that it's a well-known issue that after 2 or 3 days, when patient symptoms starts to subside, they stop the medication and they do not complete the duration of the therapy. And same goes for some chronic diseases, which later on we will discuss, that since chronic diseases, patients are taking medications for long period of time, they have to take like blood pressure medications, their diabetes medications. So after a few months of taking medications, when their symptoms are under control, patient may stop taking their medications without informing the doctors, and it can lead to non-adherence. Okay, so medication non-adherence, there are several ways to discuss it and different angles to look at it. So one of the way to classify it is primary non-adherence and secondary non-adherence, where primary non-adherence is patient is not going to refill the medications on time. And secondary non-adherence is related to their forgetfulness, or they are not following the instructions properly. So that is secondary non-adherence. And another way to look at non-adherence is intentional non-adherence versus unintentional non-adherence. Okay, so why we need to know all these things? Because first we need to identify what is the cause, why our patient is not taking the medications, what is the reason behind it, what is the factor which is hindering this. Then only we can figure it out and we can improve that process. So intentional medication non-adherence is when patient decides themselves that they don't want to follow the regimen, which can be due to their beliefs, their self-beliefs or self-perceptions. Whereas in unintentional medication non-adherence is that it's nothing related to their beliefs. They want to take their medications, but it can be due to forgetfulness or maybe due to their busy lifestyles. Okay, so this is unintentional medication non-adherence. Okay, so here we can see an interesting finding that, let's say, for every 100 prescriptions which are written by the doctor, so do we think that how many patients go and refill or get the first prescription on time? So studies have shown that only up to 50 to 70% of the patients, they go to the pharmacy for the first time to get their medications. So normally, patients will go and they will see the doctor, and if it's a mild symptoms, and doctor will write the prescription. And at this point, also many factors can come. Maybe the price of the medication is too high, and patient is scared. Oh no, I don't want to take their medication, or they are too lazy, or the symptoms are not that severe that they don't feel like taking the medications, or their other beliefs, which we will discuss later on. Okay, so let's say those 50 to 70 patients, they went to the pharmacy for the prescription. Only 48 to 66% will go back and pick their prescription. So again, several barriers are there. It can be time-related constraints. It can be too long waiting time. So I will cover all these barriers later on. Among those, only 25 to 30 patients are taking the medications as prescribed. And from those, only 15 to 20 patients are going for the refill. So here we can say, even at the prescription refilling process, there are several loopholes, and at several stages there can be defaulters patients. Okay, so non-adherence, what impact it can give to the patient? What can be the drawback if the patient is non-adherent to the medications? So first of all, when they are not taking the medications as prescribed or not taking it at all, the symptoms will not be subsided. Symptoms will keep on exacerbating. New symptoms may come. So what will happen? That they have to go and visit the doctor again and again, that, oh, my symptoms are not being controlled. And then doctor will add on more drugs. And maybe if the symptoms are severe, they have to be hospitalized for a short period of time. So all these components, it will increase the healthcare cost and decrease the quality of life. And still, if the patient is not compliant, not taking the medications, it can lead to long-term complications and even until death. Okay, so overall, broadly, we have to discuss that what are those factors or categories which can directly or indirectly influence our patient taking behavior. Because as a healthcare professionals, if we will not explore these factors, we will not be able to advise or educate the patient. Patient will come, we will just, as a pharmacist, we will just dispense the medication and maybe just give them general counseling, regardless of patient tailored counseling approach will not be there. So we will not identify, and patient will be defaulted, patient will be non-adherent, or patient will not be following the instructions properly, and eventually what will happen, the symptoms will not be resolved, and it will deteriorate the patient quality of life. Okay, so let's discuss all these factors briefly. So it can be socio-economic related factors. It can be direct patient related factors. It can be medication or therapy related factors, or it can be the condition or disease related factors. And finally, it can be the overall healthcare system related factors. Okay, so what are the items which are included in conditions related dimensions, or which as a healthcare professionals, we need to discuss with the patients? So first of all, like I discussed with you, chronic conditions. So these are the conditions which require long-term medications. So after 4 or 5 months of treatment, when patient is continuously taking the medications, this is the time when patient, can stop taking the medications. for various reasons. So what can be those reasons? First of all, symptoms are totally subsided. So let's say blood sugar monitoring. Oh, the patient fasting blood glucose HbA1c, now it's in the normal limit. Or blood pressure, now it is in the normal limit. Or let's say asthma patients, now they don't feel those exacerbations. So patient will feel, oh, I am now totally cured. I don't need to take the medications. Why to buy the medications? I can cut my cost, and also they may have why to get the side effects of the medications. So they may stop taking the medication without informing the doctor. This is scenario number one. Another scenario can be, since for chronic conditions it's a long-term process, within few weeks when the patient will see, oh, there is not much improvement in my symptoms control, they will feel that, oh, the medication is not working properly for them. As we know that for especially for your mental disorders, epilepsy, dementia, Alzheimer disease, your depression, anxiety, schizophrenia, all these treatments, it needs at least minimum 4 to 6 weeks for us to see the effect of the drug. So patient can stop taking the medication during the earlier weeks, considering that, oh, my drug is not working. Okay. And moving on, healthcare system dimensions. So here it includes patient-provider relationship and communication skills. Okay, so this one we know that overall government sector versus private sectors, we have noticed that due to several limitations, the interaction between patient and doctors are quite different, because government hospital, it is very packed, patient load is very high, doctors may not get enough time to counsel the patient or educate the patients. And communication skills, especially in countries like Malaysia or Indonesia, where we have multicultural populations, people speak different languages. So if the healthcare provider is not able to communicate in a language in which the patient can understand properly, so they cannot educate or guide the patient properly. Okay, so patient information materials. So if we are using too much medical jargons, especially on the label of the medication, if it is too scientific, like one tablet TID, so we should not use these scientific terminologies when we are educating or discussing the therapy with the patients. It should be in very layman language which a patient can fully understand. Restricted formularies, changing medications. So sometimes, like again, if it's a government hospitals, they may have some quota, or they may have restricted formularies. They may not have wide range of choices for the patients, like cost effective drugs or alternatives, drug alternatives. Poor system or missed appointments, long waiting times. So these are the barriers which for prescription refill. Patients, they have very busy schedule. Let's say you're a student or you're a working professional, you have to go to the pharmacy or hospital, but the queue is too long. So many of us, we may decide that, oh, okay, we will not go for refill because of this long waiting time. Okay, next vector is therapy related dimension. So these days, especially those patients, elderly, geriatric patients who have comorbidities, so their medication regimen can be very complex. So which will, increase your number of medications which you are taking, or multiple medications. They can easily forget that which medication they have to take in the morning, which in the evening, which without food, which with food. So all these things can mess up, and it can result in some drug-drug interactions and side effects. And second barrier can be if there is a special technique to take that medications, for example, your insulin injections or your inhalers. So although you taught them, but maybe the pharmacist was in rush, or patient was too shy to, voice out that, sorry, I didn't understand what you tried to say. Can you please repeat it? So again, communication related barriers. So since they didn't understand the techniques of those medications properly, they will use the wrong technique to administer those medications. So since wrong technique, the medication effect will not be fully optimized. Then treatment interferes with the lifestyle or behavioral changes. So again, example of those complex medication regimens like TID regimens. And let's say I'm a working professionals, I will very busy in my work life. I will not find a time, or I will very easily forget to take medication at lunchtime or in the morning. And duration of the therapy, so if it is quite long therapy, so patient which most likely to stop medication in between, especially when the symptoms are almost subsided. Frequent changes in medication regimen. So this one is mostly applicable to our geriatric elderly patients, because elderly patients, they like a fixed pattern. They don't really like changes in their daily routine. In daily manners, also the way they dress, the way they eat, even there is a slight change in this behavior, they will get upset. So same is goes for the medications. So let's suppose they are taking a blue color pill for twice a day. So let's suppose after some times doctor changes the medication, even the change in the color or the number of the doses which they have to take, it will impair their lifestyle and they will not like it, and it will take some time for them to get used to the new regimen. So in doing all these changes, it's also a risk factor for them to become a non-adherent patient. Okay, so lack of immediate benefit of the therapy, which we discussed, that for those chronic conditions, which take some times for the medication to show that effect, in between patient can relapse and they can stop taking the medication, considering that, oh, it is not beneficial to me. And finally, the side effects. So the side effect profiles, later on we can discuss it under patient beliefs also, that they may have belief also that, oh, this patient might have a lot of side effects, versus the drug is actually showing some side effects which is preventing the patient to take the medications, like ACE inhibitors. When they start doing the dry cough and all, so patient will stop taking the medication due to those uncomfort symptoms. Okay, so here we can see that as the number of doses increases, the patient medication adherence decreases. So what is the solution? So wherever possible, we can give combination therapy to the patients. So single pill with multiple regimen, we can give that. Okay, so next come the socio-economic dimensions. I think in our daily practice, we give very least important to this component, the socio and economic dimension. And this is the most important and basic dimension which can be a barrier in patient medication taking behavior. So the language barrier we have discussed already, lack of family and social support network. Okay, so this is very important, and studies has proven that those individuals or patients who are living alone, they will be more non-adherent as compared to those individuals who are living with their partners, their spouses, or in a family or joint family systems. Because when you are living with family, there will be influence from the family, there will be reminders from your family, and you will be more adherent to the medications. Unstable living conditions and homelessness, of course. So that's why we know the patients who are schizophrenic or who have mental disorders, they are mostly homeless persons. So that's why they don't have reliable care at home and they are more non-adherent. Limited access to healthcare facilities. So let's suppose if you don't have properly health insurance, or you are living very far away from the pharmacy or healthcare, so you will be less likely to catch your appointments on time or go to the pharmacy to refill the prescription on time. Okay, cultural beliefs about the illness and treatment. Okay, so this is very important factor again, because Malaysia, Indonesia, and those countries who are rich in culture, like Indians, they follow their Ayurveda or homeopathic kind of medications. In Malaysia, patients are most likely to follow the traditional Chinese medications, traditional Malay medicines, all those things. So their healthcare beliefs sometimes can influence, and they will tend to be more inclined towards complementary therapies rather than the modern medications. Okay, so some of the findings of our research work regarding chem therapies. So most of my research area, it's revolved around the neuromedical illnesses like epilepsy, stroke patients, Alzheimer's disease. So I will share some of my findings. So first of all, we did some systematic review among the global prevalence of the chem usage, that throughout the world, how much percentage of the patients they are using complementary therapy, especially in epilepsy patients. So to our surprise, it was up to 73.3%. It's quite high. And then if we zoom down the chem therapies in Malaysia, so even among general public, the usage is up to 71%. It's again quite high. So is the usage of chem therapies is okay, or we do have some issues or barriers or limitations with it? So some of the limitations regarding the chem usage is there can be some drug-drug interactions, and we do not have enough evidence-based data or trials done. So we don't have those scientific proof of those drug-drug interactions or the safety and efficacy of the chem therapy at therapeutic doses, because some of these complementary therapies, these can be part of our spices, the natural ingredients which we are using in our daily food. But when we talk about their therapeutic doses, it is higher than our dietary sources, and we don't have enough clinical trials to prove their safety and efficacy. And of course, we have some regulatory issues regarding their product registrations. There are so many fake complementary medicines which are sold online. So that's why there are, several limitations regarding its usage. Okay, so this was our systematic review in which we checked the prevalence of chem usage among the epilepsy patients. And in this study, we checked what is the impact of complementary therapies on medication adherence among epilepsy patients. And there was a significant association found in which those epilepsy patients who were taking complementary medicines, they were more non-adherent as compared to those who were not much reliant on the complementary therapies. Okay, so narrowing down to the patient-related dimensions. So it can include the patient age. So we know that as age increases, the patient medication taking behaviors, it can change. Similarly, marital status. So marital status, again, it is what I briefed you earlier based on the family support system. So if you are single, more likely to be non-adherent because you don't have any family support. Education wise, so studies have shown that the more higher education you have, you are more involved in your healthcare process. That's why you are more adherent as compared to those patients who have less education level. Okay, ethnicity, so we have discussed based on the different races and their cultural beliefs. Okay, then we narrow down to cognitive function. So this is also one of the important factor which we most of the time don't really go in unless patient is showing the symptoms of Alzheimer disease or it's a dementia patient. Otherwise, we will not really go and explore that how good or impaired the cognitive function of the patient is. So normally, the cognitive function of the patient, that is the main, the thought process, how the brain is functioning. So if we are not accessing it properly, then we will, forgetting or ignoring the main important factor of the patient health related dimensions. Okay, so this is a concept of patient medication belief in which there are four, you can say, segments or categories in which we can classify our patient. And this can help us to determine or predict that our patient which more likely be adherent or non-adherent. So let me just go through with you. So if patient has high concerns of the side effect of the medications, and at the same time they believe that, oh, the necessity to take my medication is also very high, so we park them as ambivalent patients. Okay, what is skeptical patients? Skeptical patients are those in which the fear of the side effect is very high and the necessity to take the medication is very low. So that's why we call them skeptical. Okay, what is indifferent classification? In which the necessity to take the medications as well as the fear of side effects both are low. And then acceptance is that the need or the belief that the medication is good for them is very high, and the fear of side effect is very low. So that's why their acceptance level is very high, and these are the group of the patient which will be very adherent to the therapy. Okay, so in this chart, we can see that skeptical patients are those with low necessity and high concerns, and they are at the lowest level of the adherence. And this is ambivalent. So what was ambivalent? If you see the graph, the necessity of taking the medication in their mind is also very high, and at the same time, the concern of the side effect is also very high. So these are the patients who are at the very high risk of deviating from adherent to non-adherence category, depending upon which factor will influence their mind the most, and the other will be subsided. So let's suppose if the fear of their side effect is predominating, then they will be non-adherent. So these are the patients which have to identify and educate them properly. Okay, so then regarding cognitive function, so there are several methods by which we can assess the patient cognitive functions. So these are some conventional tools. I'm sure that you all of know these mini mental state examinations. So we have paper and pen based methods, as well as we have computer based methods. Like now everything is shifting to AI technology. So the issues with these conventional methods are that they're very less motivating. Patient get bored when you are doing all those mini mental scale examinations, and it needs trained staff to perform these tasks. And some of the components in MMSE, it requires some calculation. So let's suppose if your patient has a limited educational background, they will score less in MMSE exam, but it doesn't mean that their cognitive function is not working properly. So there are several limitations and issues with these conventional methods. So in our study, in our case, we introduced the gamification to measure the patient cognitive function, in which we will ask the patient to perform a gaming task on the iPad or your tablets. And based on the game score, we can predict how good is their brain function. So this was our game, Holy Moly game, which we played with the epilepsy patients. And we also validated against the MMSE to test its reliability and validity. Okay, so it takes just only 60 seconds to play this game, and it is free, available on the Android and iOS store. Okay, so these were the instructions which we gave to the patients on the rules, how to play the game. And then our study found that there was a significant correlation between the MMSE scores and the game scores, which opens new windows in the AI technology, that we can have these interesting tasks for the patients to help in the diagnostic process, which will be convenient, easy, cheaper, and also interactive for the patient. Okay, so this was another study in which we checked the association of CAM usage and their self-perceived cognitive impairment. Self-perceived cognitive impairment means in which the patient will feel that they may have cognitive side effects from the epilepsy medications. And that's why, due to that fear, they will tend to use the complementary therapies, and they will stop taking the modern anti-epileptic medications, leading to non-adherence. Okay, so finally, we can see that among all these different chronic conditions, which of these conditions has highest level of non-adherence? So first, most is the weight reduction process. So we will be very surprised that as compared to all those diseases like asthma, arthritis, oh, weight reduction is the most difficult part. Yes. Why? Because weight reduction has to play with our mindset. We relapse. We will start, doing the healthy diet and blah blah blah, but at the end of the day or after 2-3 days we relapse, mindset relapse. We are not able to control our cravings. So that's why it is the highest one, followed by schizophrenia, which is itself a mental disorder. Okay, so finally, after identifying all these parameters and factors, how we can improve or how we can help the patient to improve their medication adherence. Okay, so first of all, we will do all these assessment and individualize the regimen which will suit our patient's daily lifestyle. We will document it and provide proper counseling, supervision, and follow-up for the patient. Okay, so first we need to classify that, oh, my patient is under unintentional or intentional medication non-adherence. Because let's suppose if the reason of non-adherence in my patient is unintentional, which means that they have no issue with the mindset, but it can be due to their memory, it can be due to their busy lifestyle, then we can help and offer them these application-based technologies, special drug packaging, and counseling to improve their unintentional non-adherence. But let's suppose if it is due to their intentional medication adherence, which can be due to cultural beliefs, fear of side effects, then we have to tailor our educational strategies to solve those barriers and improve their education knowledge first. Then once they are convinced, then only they will be likely to take their medications. If the patient is not convinced, then no matter how much we talk to the patient, they will not understand and realize it, and they will still be non-adherent to the patient. So now, like again, everything is application-based and technology-based, so we can easily address the non-adherence, especially for those who have forgetfulness issue or busy lifestyle issue. So frequent reminders can reinforce the thoughts and patient can change their habits. Okay, so what is our take-home message? The take-home message is, it is not for us to identify that if our patient is adherent or non-adherent. Like let's suppose if we are doing a research, or you are adherent, you're non-adherent. The main thing is we have to identify why they are non-adherent. And once we know that why they are non-adherent, then only as a healthcare professional, we can come and help them to solve that barrier. Okay, let me try to play this.
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes. Anna, you have to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Okay, so this is the take home message, that whenever we are have counseling the patients, and when we are asking the patient, though, are you taking the medication, patient will always say yes, they are taking the medication. So one of the the tool by which we can reconfirm that if the patient is taking the medication properly or as advised is, you can directly or indirectly ask the patient to repeat the process or to tell us how they are taking the medication. This is not them like they're always, they don't know how to take the medication, or maybe they are taking the medication 70 to 80% in a right way. So we can improve that 30%, or we can reinforce the important points to the patients. Okay, thank you so much. That was all from my side. So any questions from your side?
Okay, thank you so much, Dr. Farooq. Very mind-opening lecture for us. As we know that medication complaint is one of important issues, not only for patient, but also among the healthcare provider and the healthcare system. Okay, now I would like to invite questions from audience. You may raise your hand and open up your mic, or you can type in the chat box and we will be happy to read it for you. Okay. While waiting, so Dr. Farooq, during COVID-19 pandemic, so how the healthcare professional, especially the pharmacists, try to maintain the medication compliance among a patient, because there are so many barriers during that time?
Correct. So it was very interesting that basically it comes under the telepharmacy or telemedicine, which was introduced in Malaysia, I think long time ago, 8-9 years ago, but it was not very popular and it was not being practiced so much. So during COVID-19, especially during lockdown, it allowed all the healthcare providers to promote these services, and it also allowed the patient, they got to know, oh, the medication we can order it through mobile phone. There can be a medication delivery. So during that pandemic, so there were several value-added services which the pharmacies and hospitals, they started, which was first of all drive-through medications. So you just take your medication, like McDonald's drive-through. So you go outside the hospital and we can get the medication through a drive-through. Second was by post services, post laju in Malaysia. So the healthcare professional can send the medication through by post. And the third was our My Sejahtera app. So in My Sejahtera app, they built in all these tele-pharmacy and tele-consultation platforms like Doc to Us. So you can click, you can get tele-online consultation by the doctors and pharmacists, and at the same time, they can deliver the medications to you. And the fourth one, very interesting one, which was introduced especially during the flood seasons, because during the floods, there were many areas which was inaccessible by the cars or the jeep. So the Pharma Niaga, they used the drones to transfer the medications. So that was quite interesting. And at the same time, recently in Malaysia, they have installed the medications dispensers, just like ATM or coffee machine. So we have in, at different petrol pump stations. So patient no need to go specially to the pharmacy and queue up for OTC medications. So we can just go to that dispenser machine and can get the medications.
Okay, thank you. We have a question here in the chat box. So the social economy from Anastasia Aneta, that the social economy dimension, one of it tells about the lack of economy and homeless may have an effect. So what solution might help care providers and government give for non-adherence problem for people that have people that homeless or lack of economy, so they can get their medications?
Okay, so for this question, so first of all, in Malaysia, so luckily that their government is covering all the government hospitals. They cover all the medications through patient insurance. So local patients especially, they don't have to pay for their medications. And next question is for the homeless person. So this is very interesting question, especially homeless person, what kind of diseases they might be suffering from. So in Malaysia, the prevalent ones are bipolar disorder, schizophrenia, and drug of abuse. So all the street abusers, they are, on the streets. So once we identify the person as schizophrenia, bipolar, or the drug of abuse, so most of the times they are admitted to the healthcare facilities or rehabilitation centers. So under those rehabilitation facilities, they have proper healthcare. But yes, after 2 weeks, 3 weeks, when they are being discharged again, so there is a high chance that they will relapse and they will start doing those activities again. And secondly, since they are homeless, they don't have a clean and reliable site of care. So that's why, especially in tuberculosis also. So the chance of relapse in such patient is very high, and thus again, impacting the economic factor, that the government has to invest again in their medications, because they will relapse again and again, and it will increase the healthcare cost.
Okay, thank you. I have a question from my colleague that medication adherence in chronic neurodegenerative disease typically affecting older adults. It is very challenging. What is your opinion if they change their medication to herbal therapy?
So like I shared with you during the issues of complementary therapies are not bad, but we don't have evidence-based data to support that. As long as, let's suppose, we have conducted a clinical trial successfully, which is showing the safety and efficacy of that herbal product, I think it's a good initiative to start those herbal medications.
So do you think that it's better they stick on their medication instead of changing herbal therapy?
As long as we don't have the latest data, it is not advisable that we shift to complementary medicines, because their efficacy is not high. And the more we delay the therapy of the patient, especially for these neurological disorder, it will further deteriorate the brain function. Neuron loss is cell dead, then we cannot recover it back. Alzheimer's disease patients, if we are not recovering it, they will progress to the advanced stage, which we cannot reverse.
Okay, we have another questions in the chat box. How can we ensure whether patient are compliant with taking medication or not while they routine take medication? In our country, we use a GKN as our national health insurance, so it's completely free. So they can collect their medication. I mean, they collect the medicine. So how can we make sure they take the medication? Although although they collect the medicine from the hospitals, how can we ensure that they really take their medication at home?
All right, very good question. Actually, I had these things in my slide, but due to my time constraint, I removed those parts. So this comes under how to assess your patient medication adherence. So apart from all those subjective questionnaires in which you will ask, oh, are you taking medication on time and not? We have some objective methods by which we can assess patient medication adherence. First is that the objective method which you have highlighted yourself, that we check the prescription refill time, that how frequent the patient is coming to collect the medication on time. Is there any delay? Let's suppose patient was supposed to come on Monday, but the patient is coming 1 week after. So this already shows that there's a 7 days of gap, which means patient is not compliant, fully compliant on the medication regimen. Second is, let's suppose patient is coming on time, but how we will ensure that patient is consuming the medication properly or not. So for that, we have two to three types of various types of techniques. First is that if patient symptoms are under control, we as a healthcare professional will assume that yes, patient is taking the medication on time. That is why patient all like blood pressure is under control, HbA1c is controlled. So that indirectly shows that patient is taking the medications. And then for those narrow therapeutic index drugs, we can take the TDM. So TDM results will tell you the concentration of the drug in the plasma. And then the modern techniques by which we can ensure patient is taking the medications or not, we have the MEMS systems, in which there is a chip which is inside the lid of the container. So whenever patient open the container of the medication, it gets recorded in the chip. So when they go for follow-up, the pharmacist will screen that chip and they will ensure that the patient opened that lid, which is also not 100%, you can say, reliable. Smart patients, they can open the lid, but they will not eat the medications. So yeah, so we have to basically use subjective plus objective judgment together.
Okay, so you have to combine, right, with both the subjective and objective assessment. We have a question from Maria Melda Mola. One of the factors that influence the non-compliance in the treatment is the patient, and also related to the slide regarding the reason, like deliberate non-compliance. So what I want to ask is, what is the right solution so that in the future it doesn't become a problem in order to avoid unwanted impact? So what is this solution for the non-compliance? Okay. And also, especially for patients who may be in places that are difficult to reach, who are far from the healthcare facilities. So how to deal with this type of patients?
Okay, so if I understood the question is that what if the patient is not convinced that they don't want to take the medication, right? Deliberate non-compliance. So again, we need to know what is the reason in patient's mindset. Is it that fear of side effect? Is it that they don't believe in the modern medicines? Is it the cost issue? Is it they want to take the herbal medicines? So once we identify the issue, then we can easily, educate the patient on it. Let's suppose I feel like that, my symptoms are not severe, so that's why I can't stop taking the medications. So when I get to know this from my patient, then I will first guide the patient that if you will not take your medicines, what will be going to happen to you? So we really have to scare the patients. Uncontrolled blood pressure can lead to vessel damage. You can get stroke and all these things. So when patient get all these fear that, if I will not be compliant or if I will not follow the regimen, I will develop these complications, then patient will try to take the medications. Because as long as the symptoms are not bothering the patient will not be serious to take their medications. Unless they suddenly have some emergency attack, patient went to emergency ward, then they will be okay, next time I will take medications. So patients sometimes need that shock therapy from us.
Okay, what about if the barrier is the distance from the healthcare facilities? So how to deal with that situation?
So first of all, if it is the patient mindset, then the distance doesn't matter. Either you are living close or either you are living away. So let's suppose the patient mindset is not a barrier. It's just the location which is a barrier. So patient can request for longer refills. Let's suppose normally we are giving refills for 1 month. So for those patients who are living at a long distance, we can give 2 months or 3 months supplies. So here again can be a barrier. If let's suppose after 1 month or 2 months follow-up, there is a need to change the dosage or need to change the drug, then refund of that drug might be a barrier. Or the second option can be like in Malaysia, I think everywhere patient can just ask for the medication delivery. So distance is not a factor these days. And the introduction of telepharmacy, even you are living in some kampung, as long as you have some internet, everyone has these 4G, 3G these days. You can have online consultations and you can have online medication delivery.
Okay, thank you so much. Once again, thank you for sharing your knowledge. We have learned so many things from you today. So I think I will hand in to the committee for the certificate appreciations. Okay, the committee, would you like to share the certificate with us? Okay, I would like to invite our Dean, Prof. Samsudin, to hand in the certificate to Dr. Muhammad Junaid Farooq. Prof. Sam?
Thank you. Thank you, Dr. Uh, Junaid, for your participation as a speaker. Thank you. Nice to meet you.
Thanks, Prof. Thank you for inviting me. It was an honor.
Okay, we do hope that maybe one day you can come to our faculty, or maybe we can make an in-person meeting with you at UCSI.
Yes,
probably.
inshallah, looking forward for a lot of collaborations with Prof. Shamsuddin. So we can, go for student exchange. Why not, we call your students and we send our students during summer break, inshallah.
Yep, thank you. Okay, thank you, Prof. Samsudin and Dr. Muhammad Junaid Farooq. Now we will move on to the second speaker, Prof. Erwin Martinez Feller. Good morning, Prof. Feller.
Yes, good morning from the Philippines.
Hello, what time is it now in Philippines at the moment? Is it the same?
Yeah, it's
10?
actually 11 o'clock. Yeah,
Oh, 11. So one hour
that's 1
ahead
hour away from the
ahead
Philippines.
Jakarta time, so near lunch, right? Okay, Prof. Erwin Feller, allow me to briefly read through your bio. So, Professor Dr. Edwin Feller is at the moment a director of internationalization and linkage in San Pedro College, Davao City, the Philippines. Before that, he was a former consultant in Research Management Center and the director for international linkage at Tagum Doctors College, Philippines. He's a visiting professor in Bournemouth University, UK, and he has outstanding working experience in several national and international institutions such as MSU and SEG University, School of Pharmacy Malaysia, and also School of Tagum Doctors College, School of Pharmacy Philippines. He's a distinguished fellow of the Royal Institute of Pharmacy, Singapore, and associated member of the National Research Council of the Philippines. He was a recipient of different international academic scholarship from Germany, from Italy, and also from Thailand. He has been a speaker and trainer of different local, national, and international seminar and conference, and has received some research grant from national and also from overseas. And he has very outstanding publication, and also an editorial board member of Research in Social Pharmacy and Administrative Pharmacy, UK Journal of Pharmaceutical and Bioscience, and also reviewer of 19 reputable journals. So, that is a very outstanding CV, Professor Erwin Feller. So, Prof. Erwin Feller, you have 30 minutes to give your lecture on the, let me check, on the role of pharmacists and promotion health. So, and after that, we have approximately 15 minutes for discussions. So you may take your time.
Yes, good morning, everyone. I am Dr. Erwin, professor in San Pedro College, Philippines, one of the top university or college that is more into the and other health sciences and all. So I would like to share my screen. Let me try to, because I try to use my other laptop because of some internet connections and all. Let me try to check first my internet. But by the way, I just want to have a poll first of knowing each other first. First of all, I would like to ask number one question. Maybe we'll have it in the chat box. Maybe we'll ask which discipline you are right now. Are you in the clinical pharmacy working as a community pharmacist or are you a student? Can you show some of your messages in the chat box? What particular okay? Can we see in the chat box? Are you in the clinical pharmacy? Are you a lecturer, perhaps a professor, then, or perhaps a student? Okay, can we show it in a chat box?
Okay, for the audience, you can type in chat box about your background. Are you students? Are you clinical pharmacists? Are you lecturer? Feel free to type in the chat box so profiler can know about the background of our audience. The others, you would like to invite the others as well?
Okay, some of you perhaps are pharmacy students, lecturer in clinical pharmacy, a lecturer in traditional medicine. That's very interesting. Okay, most of you are actually pharmacy student. Yeah, so that I can actually look at how I can actually deliver then my talk. Yeah, some of you are hospital pharmacists. Yeah, welcome to our talk. Yeah, and also yeah, some pharmacy students. Yeah. Okay. I would like to ask also for our pharmacy student and also our professional here, what area of subject, okay, you like most? Okay, what particular subject you like most in pharmacy? Okay, can you put it in the chat box, please? Oncology. Wow, chemical analysis.
That's the tough
Okay.
one.
Yeah, the tough one. Yeah. Yeah. Okay. Pharmacoeconomics. Yeah, very good. Okay. Uh, okay. Some of you formulation, yeah, drug development. Okay. Pharmacoeconomics. Okay. How about others? Can we actually know what is your favorite subject in pharmacy? Okay, because it has relevance later on of the role of the pharmacist in the health promotion. Okay, yeah. Pharmacotherapy, yes. Yeah, that's great. How about others? Maybe they are shy. Okay. Can you put it in the chat box? Okay, last question to everyone. Perhaps some of you are in biochemical and pharmacotherapy. Okay. Yeah. Okay. Last question for our uh some question to have this active participation for you. Okay. What would be your role as a pharmacist then to promote, okay, to promote health? What is then your role as a pharmacist then in terms of promoting health or health promotion? Okay, can you put it in the chat box, please? Just to have a feel of our audience here. Don't worry, I have 30 minutes. Yes. Okay, some of you perhaps in the nanomedicine, clinical pharmacy. Okay, what is your pharmacist in promoting with health? Okay, some of you would answer drug availability. Yeah, that's quite very obvious. If there's no available medication, I think that is the main responsibility of the pharmacist, right? To really make sure that the medicine or the drugs are available. And of course, it's not only available, it is actually safe, effective, no? And of course, with the highest quality. Okay, with the highest quality. What else? Okay, just to have a feel. Thank you very much, Fitri. If you are near in the Philippines, I will give you a Starbucks card. Yeah. If you are in the Philippines, by the way, just to have an information that San Pedro College and universities and colleges here in the Philippines, if you want to have some global exposure in the Philippines, you want to have internship, you want to have cultural exchange, come in the Philippines. I will facilitate you, no, in terms of your global exposure here. Some of my students from Indonesia, they come here in the Philippines to have some internship in the community practice in the Philippines. Okay, so you will learn more about the culture, speaking on the native language or English, perhaps, and know about the healthcare system in the Philippines. Yeah. Okay, some of you answer ensuring that patients have access to the necessary for managing and treating for health condition. So meaning that if you are in the kampong area, you make it sure that you accessible to the public, of your service, and make it sure that accessibility is not only for rich people, no, rich people, those who are in the city area, but then we make it sure that it is accessible as far as, like, for example, in Java, or perhaps if that to be in Mindanao, or perhaps in Bandung, no, or perhaps in Jogja, no, or maybe in other areas. You make it sure that in every sick people, they may be able to have accessibility in terms of their healthcare, no, their medication. Why is it very important? Because if ever that it is not accessible, so what would happen? Pharmacology. There will be if there will be no taken medication, there will be no bioavailability. we are not talking about we are not talking about the pharmacological effect. So if the person is, like example, in the kampong area, they cannot even, there might be 30 minutes or 1 hour away from the area. It's not accessible. So what will be the effect of it? Adherence to the medication, right? Another one is not only adherence, but that also that the patient will not be on time in terms of taking with their medication. At the same time also, if it is not maintained, if it is not adherent, then what will happen? Of course, we're not talking here about the quality of medication. We're not talking about here in terms of really, you know, putting the chemicals into the body. So what will happen? We're it will not be we will not be treating the health condition of our patient. Okay? So anyone would like to put it into the chat box? What to be your role then, as a pharmacist? Okay, in terms of healthcare. Very important about the drug availability. The one that you mentioned about nanomedicine, clinical pharmacy, pharmacotherapy is very important. That is why you are very stressed, when you are in your first year until your fourth year, huh, of 4 years in terms of education. Why? Because this is very necessary so that all of this knowledge will put into action of the practice that we have in terms of our dealing with our patient. Like, for example, accessibility to there's medicine. Of course, you need to have epidemiology, public health. You need to know first about what are the necessary medication in your area. You don't sell in your community pharmacy which are unnecessary, right? Make it sure that all of this medication are available. So you need to look at orang, no, there, all the people there, that these people You need to have a survey. That's why you have research, right? That's why you need to know the people. You need to know the area, your location also. Is it accessible to the people? What are the medications that are there in your community pharmacy and all? Very important. Talking about, like, for example, pharmacotherapy. Way back then, we are product oriented, right? Product oriented. We know all these medications and all. But do we actually counsel patient? Are we actually accessible to our patient? That's the major question. And that is why pharmacotherapy is very important. Why? Because of our communication. We need to communicate this knowledge that we have in the language of the people. You don't speak English to your right, to your people, right? You talk bahasa Indonesia, in Malaysia bahasa Malayu and all, right? Like in the Philippines we speak Bisaya, Tagalog, depending upon, we have 200, more than 200 ethno-linguistics that we have in the Philippines. Very important, no? That is why very important that you need actually to know your how intelligent you are, but you don't know how to communicate this knowledge to the people. It is very, very useless. Okay. Let me try to see if my PowerPoint is already here. Okay, let me check. Okay. For a while, let me check with the technicalities. Okay, for a while. Let me check. Okay, let me check with my PowerPoint. Maybe I can send the PowerPoint to Miss Tammy because I think there are some technical glitches along.
Sure.
Okay. Sorry for the technical difficulties that we have. That's life, right? So, thank you very much. So, I would like to actually first thank the organizers for this very wonderful sessions that we have. This is a good practice for us to really to learn about the practice and looking at what is then the role of the pharmacist then in terms of health promotion. We have a lot of things that to be able to look at of our role then as a pharmacist. So okay, so I am actually staying in the very southern parts of the Philippines. I am from Mindanao. So you can see this is the last part where in the Spanish actually conquer, no, and that is why most majority, no, some of the areas are actually Muslim populations, no, in this area. And I'm staying in a very peaceful area. We call it Davao City, Davao, the land wherein you can taste a very very sweet and very good durian here in the city. Okay, so I'm located there, and we would like to welcome you if ever you come here in the Philippines, and we would like to cater interns or students from your university to be here in this region. So this is my university, San Pedro College, and I am actually this is we have two campuses, the main campus and the ULAS campus that we have, no? And this is our logo. We are more into research and development and teaching and learning of our students also, no? And in the Philippines, as we all know that we are in the verge also of the poverty, almost 80% that needed actually services in the Philippines in terms of healthcare. Very important, no? Because like for example, in our area, you can really see the realities of the healthcare system in the Philippines. Very important, no? And that is why this is a major challenge for pharmacists to really reach out, no? Reach out these people in the very kampong area wherein they have inaccessibility in terms of healthcare. Okay, so the world is changing. So as in the Philippine setting, in terms of age, there are growing population. Then there's no in the Philippines there are a lot of younger generation compared to other Southeast Asian countries. We are very thankful to that, but the 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 going out of like for example workers from the Philippines, of the healthcare workers going outside in European, US, Saudi Arabia are really vast. And for us pharmacists, there's a lot of opportunities going outside of the country. And you can see the realities then from the kampong area wherein there are minimal healthcare workers also in the Philippine setting. Okay, they may be staying in 1 or 2 years or 3 years to have experience, and after which they go outside of the country. There are influx then of growing non-communicable disease. In fact, there are top 10 mortality and morbidity in the country, wherein one of the top 10 is stroke, hypertension, diabetes, still cancer are top 10 mortality and morbidity in the country. The rising costs in terms of healthcare, and that is really the major problem in a pharmaceutical area wherein there are growing trends of medicine costs, very expensive costs in the Philippines. And of course, the globalizations, as we all know that really, a lot of problems arising because in the Philippines, there are fragmented in terms of healthcare in the Philippines. And with this, it's very important that we really, invest a lot in terms of the healthcare. There are 24 million deaths that can be prevented with the help of the healthcare provider and with the pharmacist. We are the ones that contribute in terms of the death of the people. Do you know that? Because if you don't counsel your patient, you don't take part of the healthcare system. Yes, you, yes, all of us are part of the death, the cause of death of our patient. We need to do our part as a healthcare provider. And that is why it is a very growing trend of non-communicable diseases, the one that we eat, no, in terms of a lot of cholesterol, a lot of fats, excessive alcoholism, poor diet, and lack of physical activity is one of the cause of the risk factor in terms of non-communicable diseases, especially smoking. And that is why it is a great role for us as a pharmacist in terms of smoking cessation program, even in the community pharmacy. And that is your role soon to be as a pharmacist or those pharmacists that are here in the hospital setting. We are not a mere dispenser in terms of the medication, but then we take part of the daily routine in terms of medication therapy of our patient. We are there for our patient to disseminate a good information in terms of their lifestyle. Because how much and how effective and efficient and of course with quality and all, but if it is not taken by the patient because of non-adherence at the same time, the lifestyle of our patient, too much salt, tobacco use, alcoholism, and all, the medication will be useless. And that is why it is very important your role as a pharmacist. Now, this is during COVID-19. Very important your role as a pharmacist then. Even you are in the community pharmacy, you are not just a mere dispenser of the medication. You are part of the healthcare system. Yes, you are part of the healthcare system. Why? Because all of the referral of the prescription are there in your community pharmacy. Very important that you be able to transcribe the correct medication at the correct time at the correct patient. And that is why the quality starts from you. Yes, from you. Because very important that you are taking part then of this not of this healthcare system as a pharmacist. Now, patients are getting to become more complicated. There's a lot of determinants of health. Complicated because number one, in terms of their diet. Number two, in terms of education, some of them are uneducated, illiterate. No, even though you disseminate information to them, they don't understand. And that is why a major challenge for all of us, even the work environment, very hazardous environment, no? And of course, the food that they are eating, fast food and all, and the water, the sanitation, even the housing. You're staying in a in a house where in because you are family centered, you are 10 of you in a house with multiple multiple in your family and all. Because of poverty, you are staying in a squatter area or in an area which are unhygienic and all. Very important, the determinants of health. That is why we cannot judge our patient, no? That is why the patient cannot buy the medical. We cannot judge them or they are poor and all. It is because they cannot afford the medication. They rather go into traditional medicine. I'm not saying that it is not effective, but then you know there are a lot of factors that we'll be able to look at as a pharmacist. And of course, very important, your role, our role as a pharmacist in terms of public awareness, patient engagement is very important. No? This is not the time we're in. We just give the medication to our patient. We need to engage with our patient. We need to talk to them, no? In a layman language. We need to engage ourselves, be part of their agony, be part of their pain, be part of their stories. You are there to help them, no? To help them. And of course, involve them, your involvement in terms of your organization, the involvement in terms of your patient, no, and a lot more. We need to have all these practices. We need to be engaging in terms of the patient. People should know, no, the public should know what is your role as a pharmacist in the community setting or in the hospital setting. Because some of them, they say that you are just a sales lady, you are a glorified sales lady. You are just there to give medication. But beyond that, the patient don't know what is then your role. You need to show them. You need to be visible to them. No, you need to be visible to them also. And of course, we need to be aligned on what is then the sustainable development goal, reaching out to the poorest of the poor. No, it is not all about giving with medication, but then it is all about prevention, promotion in terms of the healthy lifestyle to our patient. This is what we call as global health pharmacy, reaching out because your problem in Indonesia is similar in Malaysia, maybe similar in the Philippines. We try to look at our practices, good practices, how you be able to disseminate counsel with your patient, how you be able to share uh, product, information, healthcare, no? How you be able to engage with your patient and all. That is very, very important. Reaching out the sustainable development number three, good health and well-being, the prevention part, promotion to our patient. No? And there's a lot of researches about this that alcoholism, habitual smoking is actually related then to a lot of comorbidities to your patient. And of course, accessibility and the costs are quite high, for patient having all of this. No? So very important, very, very important that you are there as a pharmacist to uplift in terms of their knowledge and perception about this. Educate your patient. No? Because without education, just give your patient and all, they will not think about it. They will not actually bother about the medication. So we are there to educate our patient and all. No? It's very, very important. So in terms of the workforce in the Philippines, there are most of us in the community pharmacy. Would you imagine that all of this community pharmacy will be able to promote healthy lifestyle, that will be able to have smoking cessation program, that they be able to have healthy lifestyle to the patient and all? So what will be the impact then to the patient? What will be the impact to the public health? That has a good impact. How many pharmacy here in our place only? Like example, 200 botica or community pharmacy. Surrounded every corner, there is a community pharmacy. If ever all of the pharmacists there will cooperate to disseminate health promotion, what will be the impact? There's a great impact then to the public, to the society then. And that is why do not underestimate yourself. Yes, do not underestimate yourself because you, yes, all of you who are listening right now, you have a concrete role in the society. We should not underestimate ourselves. We have the role in the society. Whether you are in the hospital pharmacy, it has a great role in the promotion of health. It's not only assuring safety, quality, and effectiveness of the medication, but offer your services like smoking cessation program. Like, for example, getting to know about their medication. No, it's very, very crucial. Simple project, simple program, but it has an impact then to the community or hospital setting then. And most of us, most of the healthcare professional, particularly the pharmacy workforce, are female population. No? And if you want to integrate yourself to like the use of contraceptives or the use of like for example reproductive health, no, if that would be the thing, no, or whatsoever. Another one is moving forward according to FIP intelligence report. If you look at in the Philippine setting, the pharmacy workforce is not only about pharmacists. We need really to educate also our pharmacy assistant, pharmacy technician, and all. Why? Because they have a great role in terms of health promotion. It's not only the role of the pharmacist, but then pharmacy technician has a great role also. And to think of it, they are quite great, quite high in terms of the number of population of pharmacy assistant and of course pharmacy technician in the country. Very important. And to sad to say that Filipinos love to migrate to other country to work, no? That is really the challenge for us in the Philippine setting also. Very important. And that is why we need to keep our pharmacists here in the Philippines also. Based upon the research in social and administrative pharmacy, very important in the Philippines, in the global picture of pharmacy technician and the pharmacy work important is getting higher and higher in terms of the pharmacy workforce. And that is why very important that it's not only the pharmacists that will be able to educate in terms of health promotion, but then also to the whole public, not to the pharmacy technician also, no? Educate how we be able to counsel in terms of self-care. Very important. This is our the words from the World Health Organization and all. If you try to look at also in the Philippine context about the pharmacists and the pharmacy support workforce, there's a lot of the technician workforce, no technician, no, compared to the pharmacists also. That is why they have also the great role in terms of health promotion. Very important. Now, in terms of we need to educate. Where do the education comes from? It is all about it's all about first all of us in the field. That is why I really admire this university that opened up to educate the public in terms of really looking at the role of the pharmacist. The role of the pharmacist starts from us. No? As all of us in the pharmacy workforce, we need really to educate ourselves. What will be the role then? No? What is your role as a pharmacist so that you'll be able to identify programs that can cater what are the good programs that can I serve, no, like for example you can have like free checkup, free medication counseling in your own community pharmacy. You don't need to complicate yourself of all the programs. Simple program that can actually give meaningful results to your community. You can do research, a mini research. What are the medications that they need? No, you can actually sort out, no, some medications. No, you can also do that. No, there's a lot of things that you'll be able to do. Document it and disseminate that information that it is very effective. You don't just keep it to yourself. You need to put it into a research, a mini research, and share it, to your co-pharmacists that are effective methodology that you'll be able to do. No, there are if a lot of effective interventions that you can do in terms of health promotion. Yeah, there's a lot, especially during the COVID-19. I myself are doing research in terms of the national free online consultation. What are the role of the pharmacist during the time of COVID-19? We have, like for example, psychological first aid. We do also medication counseling. You know that during the time of COVID-19, there's a lot of services that we do in terms of mental health, a lot of depression, a lot of anxiety. You can see that one in our published work, no? In a lot of journals about COVID-19 and the role of the pharmacist in terms of that. So a lot of things that you'll be able to do. Okay, and you will have a good outcome with that. So that's why very important you'll be able to disseminate because that will added up competency for pharmacists in terms of health promotion. You can see also a guideline that I have published in my book, no, in dispensing book about the role of the pharmacy support personnel. And most of health promotion are within the pharmacy technician and of course with the pharmacist. Okay. Yeah, that one. Okay. And the responsibilities in the pharmacy in terms of the workforce and all. Very important. Uh, as you go higher to the ladder to become a pharmacist, then you have a great role and responsibility. And one of the responsibility is dissemination of the of health promotion to the public. Very important. So you need to have basic competencies. No, it started with education. You don't just go there in the pharmacy and you are not competent in terms of health promotion. No? Like for example, competency in terms of smoking cessation. You need to undergo certification. Like we collaborated with Malaysian society in terms of our competency for pharmacists because they are very good and excellent in terms of competency for competency in terms of smoking cessation. So we try to tie up in terms of our education so that once they are already in the field, they are competent in terms of, really very confident in terms of giving back what they have learned in terms of serving the public, no? Because there's a lot, according to the research that we have conducted, they are not confident in terms of really putting into health promotion. Why? Because why is it that they are not competent? They are not certified. They are lacking in terms of competency and all. So very important that this competency, basic, common, and core competency must be disseminated to the public, no, to the pharmacists and to the pharmacy technicians and all, no. So we conducted a lot of competency assessment of the different universities and colleges in terms of healthcare services and pharmacy technician certifications and all. And of course, in our association, the Philippine Pharmacists Association, we conducted a lot. No? Even we published in terms of the Philippine practice standard. What are the competency of the pharmacist in public health, in community pharmacy, in hospital pharmacy, to become a leader in the field of health promotion and public health. Okay, so one of the competency that you need to have is all about professional, legal, and of course, very important in terms of ethical manner. Now, what are the ethics behind of health promotion? Leadership, management, cultural competency, because there's a lot of foreigner already. No? And of course, good communication and interprofessional collaboration with the people. Because if you don't collaborate, no, with the healthcare professional, it will be useless. You need to collaborate with medical practitioner, with dentists, with traditional medicine practitioner. You don't need to isolate them. You need to collaborate because collaboration is the key in terms of a good health promotion. Okay? And this is how we be able to advance ourselves. We need to specialize. And that is why specialization in terms of certification for smoking cessation, for pharmacotherapy, and others. No? Even like, for example, vaccination. No? In the Philippines, we try to certify that is based upon our Philippine pharmacists. So we have almost 2,000 immunizer in the Philippines. They're specializing in terms of immunization and all. That is one of our services, no? Immunizing pharmacists. That's one of the specialization that we have under the Philippine Pharmacists Association. I am actually one of the officer of the national in terms of the Philippine Pharmacists. I am a board of trustees in the Philippine Pharmacists Association. Very important, no? Very important our role as a pharmacist in terms of immunization. And of course, in terms of telepharmacy, telemedicine, very important in terms of referral system. No? And we are taking part of it during our national free online consultation. We also do telepharmacy, no? Telehealth during that time. Very important, our role. It's not only during the COVID-19, but until now, very important in terms of telehealth. These are the health educations and health promotion that we have during the pandemic. Very important, the online format, no? In terms of really disseminating information, and they can transmit it into their patient in terms of uplifting the learnings that we have in terms of the pharmacy, no? In terms of like skin dermatitis, in terms of like traditional medicine, how to handle no, and et cetera, et cetera. So there's a lot of continuing professional education or development with our pharmacists, no, upskilling, no, with our pharmacists in terms of patient management and all. Even we have our national convention every year during April or May, no. So we try to make it sure that health promotion is there throughout the educating our pharmacists, no. For smoking cessation, pharmacotherapy, health management, medication management, no, diabetes mellitus and hypertension management, and a lot more. A lot of role, even like self-care, very important because you are not there 24 hours to your patient, right? You're not there uh, 24 hours. So you need really to educate, empower, engage your patient, no? Or what you have. So that's why very important. So I think that's all. I would like to open for question and answer in terms of my topic, the role of the pharmacist in terms of health promotion. I'll give back to our MC, yes, or
Okay,
moderate.
thank you. Thank you, Prof. Erwin Power. I would like to invite questions. You can raise your hand, ask directly, or you can type your question in the chat box. Okay. So, Professor, what are the barriers actually to involve the pharmacists in health promotion program?
I think one of the barrier that I have actually mentioned is all about the learning of the pharmacist, and that is why we need really to have this continuing learning, no, learning to all of us. Another one is the confidence of the pharmacist. If they are confident, knowledgeable about it, they be able to have this health promotion, and that is why there are some pharmacists that are they are contented already what they are doing right now dispensing medication. It's like a sales lady. You know why? Because uh, they are lacking in terms of the skill. Number two, they are not confident. It added up work to them and all. So if there are proper like dissemination, what is really the role of the pharmacist? They rationalize it, they understand it, from the basic educations that they have. I mean, from the pharmacy educations that they have, they will really practice what is needed in terms of the practice. Maybe another challenge is all about the competency. We need really to enhance our education from the first year, second year, third year, fourth year. Way back then, it's product oriented. Nowadays, it's all about OSCE. No, it's all about objective structure, clinical examination. It's all about dealing with patient. It's all about practicality in the field. As much as possible, we learn a lot of dialect. We learn a lot of languages. We learn a lot of because it's all about engaging with people. Way back then, it's all about the medication. You just memorize everything. But nowadays, you can even use your cell phone. You can even use your tablet or computers, right? Automatically, the knowledge, I mean, the information is there. It's all about engagement. It's all about talking with your patient people. Okay, that's the new
Okay,
trend.
thank you.
That's the next generation that we need really to confront with.
Okay, we have question from Fitri. I think quite easier to monitor patient medication while they are in the health facilities, but when they go home with the family, their family and public will take the role, especially for chronic disease. Well, what's your advice and tips about it for the medication adherence? I think this one.
Yeah, that is why I have a lot of research about the effectiveness of, like, for example, hypertension or diabetes. Very important. I have noticed in our intervention, very effective intervention is a monitoring of our patient using telemedicine, telepharmacy, or your patient. No, it may be added up in terms of your work, but it's very satisfactory. We have published it in a different journal about effectiveness of like telemedicine intervention or telepharmacy intervention. Another one is a collaboration with the doctors, collaboration with other pharmacists, or collaboration with your community health workers that are in your field, like nurses or in the field and all. Because if you have a strong collaboration with them, you'll be able to identify easily. Because, like for example, They will not admit that they have taken a lot of rambutan or longan, no? And that is why, oh, why is it that the blood sugar is quite high? They don't admit it to the doctor. They don't admit it to the pharmacist sometimes. They don't admit it to other healthcare professional. No, very important that documentation is very also important, no, in the field. And of course, the use of technology. That's one of the tip that we have. Why is it that you waste your time documented in a paper? Well, in fact, you can document in the Excel file or document it in the in your computer and all, so that you have a system. System is very important to make your life easier. And that is why you will have lesser in terms of technicality of preparing the medications and all and everything. Everything is already prepared. My God, no, everything is already prepared. It's all about your engagement, your patient. Talk to them. Not talk to them, monitor with them, document it that they have taken your medication, what's the blood pressure. Another expanded services is actually monitoring it. Just put device and let them or teach them how to self-care in terms of monitoring themselves. They're automatic blood pressure already, automatic in terms of the blood sugar monitoring. Everything is already automated. The only role of the pharmacist that cannot be replaced by AI or other technology is you. If you engage yourself in terms of the monitoring processes, in terms of, monitoring processes for this, so very important your role as a pharmacist.
Okay, I think the next question is quite similar with mine. So, how to deal with the challenge that the pharmacists face in health promotions?
Be innovative, no, in terms of your practice. Do not be satisfied of the daily routines that you have. No, like for example, 8 hours in the pharmacy dispensing medication. Try to innovate. Have some services in your community pharmacy or hospital's pharmacy. Why? Because our role as a pharmacist are quite very diverse. Very diverse. You will be bored of your practice just dealing 8 hours in a day, dealing with all the medication, giving with the medication. You don't even talk with your patient. Document it. uh, Engage with your patient. Be innovative in terms of your practice. Do not be satisfied of the 8 hours of time, having a routine work and all. Very important. No, very important to be innovative. Do some a little bit research, no research of it. Mini research. You don't need to have a lot of fundings, to do research. Collaborate with like for example this university. Collaborate with different experts. No, academic, they would love to collaborate with you in the community or in the hospital setting. No, because that's one of their KPI, by the way. But then it's very important that that what we have learned must match into what is in the industry. No, try to talk with the academician. If you are in the practice, talk with them. If you are in the academician, talk with the practitioner also. Be innovative in terms of your practice. I have dealt with a lot of research, dealing with practitioners in the field. Even like, for example, community health workers. I am dealing with nurses, medical doctors, and all. I don't care. No, this is all about our patient. This is development of public health in the Philippine context. No? And that is why your intervention is very important. Yeah.
Okay, thank you. We have some question. The next one is how technologies and telemedicine can impact the role of pharmacists in health promotion and what adjustment that we need to make for that.
Very good question, no? We can use actually technology like TikTok. TikTok. There are actually pharmacists who are also doing TikTok. Do you know that? Even like for example in the Philippines or even in Indonesia, disseminating information what is really how we be able to prevent diabetes, how we be able to have a good meal that is less in terms of sugar and all. These are the information, broad informations that we can disseminate to the public. This will change life, no, to our patient. Why? Because you can to add up more, you because they don't have time. No, time is very crucial with our patient. We just give them a link. I have a study about intervention about a video that is using a QR code. I just give the QR code, no, and then the patient will just unravel on it about a lot of videos about diabetes or hypertension, how to like meal, no, how to prepare their meal for a diabetic person and all, how to manage in terms of their hypertension. These are videos to create. Use social media not only in terms of scandals, but then use social media in terms of health promotion. Very important. We use technology. Technology should not use us, but
Yeah.
we use technology in terms of advancement of our the pharmacist and the development of the benefit of our patient. Yeah.
Okay, thank you. Well, another question, how to improve the party's confidence in delivering the healthcare?
In terms of
So yeah.
confidence, that is really educating our pharmacists. No, you cannot have confidence telling, oh, this is the medication, ma'am, and then you are frowning or you don't know how to have a good communication. You don't have a confidence. It will transmit. They will say, oh, the pharmacist is not confident. I am in doubt with my medication and all. So confidence starts from you. No? Listen, you need to be a leader in terms of a good management to your patient. Tell them you need to have a good command to your patient to take with your medication on time. Because if you just have a bad communication, you are very shy, you have a very small voice, no, and all, it doesn't pass to your patient. Because remember, Google Health, Yahoo, Wikipedia are there for them. Social media, WikiHealth, those unreliable information will swallow them, no, in terms of their health. Very important, very, very important that you have a command to your patient. You need to have a confidence. Give them information, teach them. You don't discourage them to use social media or all this information. Why? Because at the end of the day, they will try to go to this media. Teach them what are the good information, no? Teach how to have self-care. Teach them how to take care of themselves. Teach them how to use their medication, right? So at the
Yeah.
end of the day, both of you will smile and say, how are you today, ma'am? How is your medication? No? So it's all about engagement. It's all about innovation. It's all about talking with your patient. Yeah. To build up this kind of confidence that you have. Attend a lot of seminars. It's all about investing of yourself as a pharmacist. Even though you are a student, yes, all of you that are here, no, those students are here. Invest right now by engaging yourself, you listen to me, you are inspired, you are confident, no? Inspire yourself to add more into we cannot actually everything in a 4 years, no? Try to engage more continuing education. Learn each and every day, no, into yourself to add more confidence to yourself. Yeah.
Okay, thank you. Because of the time constraint, I think the last question will be because the majority of the audience are pharmacy students. So what should they prepare so they can be the part of the health workforce that can promote the health well in the future?
You are actually starting to prepare by listening right now with the professor a while ago. And right now, I would say that you are now preparing in terms of your future to become a health promoter. By attending right now, I would say I am confident, no, that when I go to Indonesia and buy ubat-ubat and all, I would say that I am confident, no, as a Filipino visiting Indonesia when I go to your pharmacy, ma'am, can I buy You will not say, "Oh, I cannot speak English." You are confident because you have a good oral communication. You can speak with different languages. You can talk with patient, whether it's a foreigner or not. You can even look at all your medication. You are familiar with it. It's not only about the product. It's all about you can talk. You are confident with your patient, whether it's online, whether it's a telehealth, whether it is actually in your community or hospital pharmacist. Because at the end of the day, please do remember that this is for the health of the people. This is for Indonesians. This is for the health of the people in the world. And that is why to be ready, to be confident right now, no? And a lot of seminars that will be able to have conference. I hope that I will be invited next time in a face-to-face, so that you can see me, me, in your conference. I hope that when I go to your conference, you will go to me. Sir, thank you, for really building my confidence. That really started, awaken my mentality, awaken my mind, in terms of our practice as a pharmacist. Yes, you are not a glorified sales lady. You are not just there to, to watch your medicine or to watch with your patient and all. You have the great goal in your practice. And that is why the role of the healthcare, the role of the pharmacist in the health promotion is very broad. Try to specialize. What is really your need? What is your dream to become? No? And that is why, like, for example, you want to take care with diabetes because your family member is one of a diabetic. Start with your family. Talk with them. Engage them. Do you know the medicine or mother? Your ibo, your bapa? Do you know the medicine, the ubat-ubat of your father or your mother? No? Talk with them. Educate them about their medication. Try to schedule the medicine. Have a medication therapy management. Starts with your family. I know you are listening right now. Start with your family. No? And that is why I started with my father also. When he was sick, long time ago, I really schedule that. I'm making sure if that would be medication, that's my term. That is what I want to share with my father who is sick. And that is very important. Touching lives is very important. With your talking with your patient, engaging with your patient, you are inspiring and transforming the lives of every unhealthy Indonesian in the country. And that is what the message that I am talking to you right now. Sharing with you right now is like talking with millions of Indonesian because I'm sure that some of you become lecturer, some of you perhaps will be going to become pharmacists in the future. That's why we need to be competent in our practice. Thank you
Okay.
very much.
Once again, thank you for sharing your knowledge, experience. Thank you for inspiring and giving us motivation. So, as the part of our appreciation, we would like to hand in our certificate. The committee, maybe you can share the certificate so we can hand in to Professor Erwin Fellow. And Prof. Erwin, we are looking forward to visiting you in Davao and tasting your durian. The committee, the certificate, please. Okay. Okay. Professor Erwin Martinez Feller, thank you so much for being one of our speakers today. And we are looking forward to meeting you, or maybe you can visit us one day in Jakarta. Thank you so much.
Yeah,
Okay,
terima kasih and jumpa lagi to everyone.
Yeah, thank you. Okay, we are nearly at the end of our guest lecture. I would like to hand over to our MC.
All right, thank you so much to Ms. Hasti and also to our speakers for the lecture. It's an amazing discussion and also insightful. And just by that, we got motivation by Professor Erwin to become an extraordinary pharmacist in the future. So I would like to say I would like to say thank you to all speakers, moderators, and participants that partook in this session. And next is certificate appreciation to our amazing moderator who lead our session properly. So, okay, now maybe the committee can share the certificate to our moderator, Ms. Hasti. It's an amazing discussion, actually. We get just motivated by Prof. Erwin. In Indonesia, we
Yes.
have motivator. It's Mario Teguh, right?
It's like Mario Teguh. Yeah. I'm so
Okay.
sorry for the question that we haven't answered because we have limited time.
Yes, right,
Yeah,
Miss.
they can
Because
send it via email to me so that I can answer those.
Yeah. Yeah. Thank you so much, Professor.
all right. Okay, the certificate just handed to Miss
Yeah,
Hasti.
thank you. Thank you so much,
Okay, all
the
right.
committee.
Okay. By that marks the end of our lecture today. I'm Amalia Zahra as Master of Ceremony representing the committee. We would like to thank to all speakers and participants that have joined this lecture truly. We would like to apologize if there are any mistakes along the way. Hopefully we can meet again in another moment. Wassalamualaikum warahmatullahi wabarakatuh. Shalom, Om Santi Santi Om, Namo Buddhaya, Salam Kebajikan, Salam Pancasila.
Salam Pancasila. Enjoy your weekend, everyone.
Thank you, Ms. Hasti. Enjoy your weekend too.
Thank you very much.
Thank you, Prof. Erwin.